Hello, and welcome to Behavioral Health Services. My name is Jennifer Wolf Kimball, and I'm the Communications Specialist for our department. I'm responsible for writing press releases and articles about the work that we do, maintaining our website information, supporting community events, and managing our social media accounts. We are so excited to share information with you as a part of the Larimer County 101 series. We'll be sharing a bit about the history of our department and the kind of work that we do in the community. We'll also tell you about behavioral health services and the facility that's under construction. And we'll share a bit about our Impact Fund grant program. We have a lot to cover in our time together, so let's get started. I'm going to turn things over to Lori Stolen, Director of Behavioral Health Services.
Hi, everyone. Let's start off with a definition of behavioral health. Behavioral health is the promotion of mental health, resilience, and well-being. It also includes the treatment of mental and substance use disorders and the support of those who experience and or are in recovery from these conditions, along with their families and communities. It's important to understand that behavioral health consists of the integrated delivery of care by psychiatrists, primary care physicians, social workers, and other healthcare professionals. I want to talk a little bit about behavioral health and how we came to be. If you don't already know, in 2018, the Larimer County voters passed a 20-year ballot initiative that dedicates a 0.25% sales tax for mental and behavioral health purposes. The ballot language presents a two-pronged solution to that initiative. One is the provision of preventative, early identification, intervention, support, and treatment services for all ages, either directly or indirectly, who are Larimer County community members. Secondly, to acquire, construct, remodel, staff, and operate new and or existing mental and behavioral health facilities. A little bit more about our facility. When we became a department, we as a team created a vision and a mission to help drive the work that we do. We also have created a framework of 3 funding pathways to invest back into the community. The first one is our behavioral health facility that is under construction. It's a 64-bed facility with 6 different levels of care. We are in contract partnership with Summit Stone Health Partners to provide those clinical services in the new facility. And it's intended to be acute behavioral health care for all members of Larimer County. The second funding pathway is our Impact Fund grant program, which we will go into more here in just a little bit. The Impact Fund grant program is an annual allocation of dollars through our Board of County Commissioners. It's intended to redistribute dollars back to the community to expand and enhance behavioral health care. The grants are awarded to organizations that serve the behavioral health of all Larimer County. And it's an annual grant program that focuses on targeted and responsive grant types. The third future initiative, which is a funding pathway, is our Bridge Fund. It's intended to be a fund to remove the barriers of care for folks that are getting services in the facility and as they try to transition back to the community. These might include items such as transportation, co-pays and deductibles, supportive housing, or telehealth access and services. Our initiative has been divided into 5-year phases. Over the 20 years, we are now in phase 1, which is 2019 through 2023. And we have done much work so far as we are finalizing phase 1 of this initiative. As you can see here, we've established the department, we've established the framework for our grant program, and we are in the midst of constructing the new acute care facility. Our goal after the facility is opened to create the framework for our Bridge Fund program. That will wrap up phase 1 of our initiative. As we enter phase 2, which is 2024 through 2028, the first 10 years of this 20-year initiative, we will hope to get the facility operational, implement the Bridge Fund, and to do some expansion of our behavioral health campus. As we go through the details of this presentation, I will be having the staff themselves introduce themselves and talk about what they do within our department. So with that, I will turn it over to Summer to talk about behavioral health finances.
Hi, my name is Summer Leeming, and I am the accountant in Behavioral Health Services. So as Lori mentioned, we received a 0.25% sales and use tax approval back in 2018, and this generates on average $20 million for the Larimer County Behavioral Health Services Department. So 2021 was a great year for us. We had total revenue of just a little over 22 million, and our total expenses were just a touch over 6 million. We typically award around 2.5 million in grants, but we did increase this slightly in 2021. So it was 2.53 million. And then this note at the bottom just states that we have a cumulative balance that we hold. And this is for the large construction project of our facility, as well as future services. And this is at 44 million currently. So that is a wrap up of our financials. I will hand it over to Kim.
Thanks, Summer. Hi, I'm Kim Pretty, Senior Business Analyst, and I do data and evaluation for behavioral health. One of the core functions of our department is reporting to taxpayers on the impact of the sales tax dollars they approved in 2018. This includes data about the behavioral health conditions in Larimer County and how the dollars put towards their improvement are potentially impacting them. We currently analyze the data in two ways. The first is looking at community level statistics about mental health and substance use. On our website, we maintain a regularly updated dashboard that has data about emergency department visits for mental health and suicide related reasons, as well as substance related visits. Additionally, we obtain data from the Colorado Department of Public Health and Environment to track suicide and overdose deaths. This community data allows us to compare the Larimer County rates with the state of Colorado, as well as track trends over time. The second way we analyze our data is through the evaluation of the grants made through the Impact Fund grant program. Again, we use a dashboard to keep track of our spending, the organizations and projects that receive funding, and other details about our grant-making activities. As our grants are completed, we then compile data from each grant cycle to look at what populations were reached, which goals were met, and how the programs we fund contribute to improved behavioral health and well-being throughout the county. In the next few years, as the facility becomes operational, we will continue to add to our measures of impact through the results we obtain from that effort. And I will turn it over to Lori to talk a little bit about the facility.
Hi again. So as you can see here, we are planning to open the facility in late 2023. We've got some pictures of the construction that's going on at the site, as well as some renderings of the facility once it's completed. So as you can see, we are well underway with the construction. If you haven't been by the site, you can certainly see it as you drive down Taft Hill Road. The address of the site is at 2260 West Trilby Road. We are fortunate to have a 40-acre site that we look forward to building out a campus of well-being over the years of this initiative. You can see the renderings of the inside and the outside of the building. Our intentions are for this to be a warm, safe, welcoming place for folks that need care to come and get the care that they need. We have designed it intended to complement the environment in which it sits, the nature that surrounds the facility, the views of the foothills, and the open space that is all around where this facility sits. The services that will be provided in the facility are intended to be for Larimer County community members in need of urgent care for mental health and or substance use disorders, regardless of their ability to pay. We wouldn't be successful at this endeavor if it weren't for our collaborative partnerships in the community. We are so thankful to be in contracted partnership with Summit Stone Health Partners, who also partners with UC Health, one of our largest medical care providers in the community. Summit Stone is one of the region's largest behavioral health care employers. They've been serving Larimer County for over 60 years, and they have many locations throughout the county in Estes Park, Fort Collins, and Loveland. They provide mental health and substance use disorder services for adults, youth, and families in our community. A little bit about the services that will be provided within the facility itself. It's a 64-bed facility, and it will provide care 24/7. The facility will include an urgent care, 23-hour observation that includes assessment and care coordination. The intention is that anytime a client comes to the facility for services, as soon as they are admitted, their discharge planning will begin to ensure a smooth transition back to the community. There will also be 2 levels of withdrawal management: medication-assisted treatment, crisis stabilization, a short-term intensive residential treatment program that's intended for those that have gone through detox and need a longer stay for stability before they return to the community. We will also have a bridge clinic that's intended to provide primary care for folks that haven't found a permanent health home in the community. So this bridge clinic will provide that primary care for them until they have found that physical health home in the community. You'll also have on-site pharmacy and lab services at the new facility. So you might be asking, who will use this facility? Well, our intention is for this to be able to provide services to folks of all ages, from 0 to 118. So it will serve adults, youth, and seniors from around our community. We hope that first responders, law enforcement, and our co-responder partners will utilize this facility anytime they are in contact with someone that is having a behavioral health crisis. We have observed over the years that there is an overutilization of more costly levels of service, such as emergency rooms and our criminal justice system, that aren't providing the right levels of care for folks that are in behavioral health crisis. So our goal is to be able to provide the right level of care for folks at the right time. We also see this facility as a teaching facility. We want there to be opportunities to develop our workforce, to be a center of excellence as a national model for how to provide best practice in behavioral health care. Our goals are to provide student experiences and the opportunities for internships, fellowships, and residencies for doctors that are interested in a career in behavioral health. Some of the exciting things that we have upcoming within behavioral services is the naming of our campus. We will be bringing options for the name to our Board of County Commissioners this summer. We also have virtual lunch and learn presentations that are co-hosted by Behavioral Health and Summit Stone. Those lunch and learn presentations are offered on the 3rd Wednesday of each month from 12 to 1 o'clock p.m. You can find out more about those lunch and learns on our website. Also, Summit Stone is going to be hiring over 180 new jobs to provide the services in this new facility. So if you know of anybody that's interested in a job in behavioral health, please refer them to Summit Stone Health Partners. Our upcoming plans for a collaborative center of excellence with Colorado State University and Summit Stone is an exciting component for our community to help build out the workforce in behavioral health, not just for our facility, but for behavioral health providers across the country. We're also looking forward to working with the state on some American Recovery Act funding to potentially accelerate the phase 2 of this campus by adding an adolescent care facility. And we will have more information about that opportunity as those funds become available. So please check back to our website for more information. With that, I'm going to hand it over to Jess to talk about our Impact Fund Grant Program.
Hi, everybody. My name is Jessica Plummer, and I'm the Program Manager here at Larimer County's Behavioral Health Services Department. I oversee our Impact Fund Grant Program, which, as was mentioned earlier, invests funding into the community through an annual grant process in an effort to increase access to behavioral health services and improve outcomes along the continuum of behavioral health care. The Impact Fund not only houses the annual grant program, but also crisis response initiatives and other efforts that support countywide behavioral health needs. The program is designed to address critical gaps in the community, and our funding priorities are to improve access to care, care coordination, early identification and intervention, stigma reduction, quality, behavioral health care, and prevention. Our grant program has not been established for very long. As you can see, it began in 2019, and we're just entering into our 4th year of funding, where we anticipate awarding another $2.5 million out later this year. Over the past 3 years, we've made 110 grant awards to over 57 different organizations and distributed just over $6 million back into the community. Now I'll hand it over to Ryan to talk about our advisory groups and how they are involved in our Impact Fund grant program.
Hi, everyone. My name is Ryan Barstow, and I'm the Business Operations Coordinator for Behavioral Health Services. For anyone like me who isn't fluent in human resource jargon, what that means is I contribute to the department by coordinating meetings, managing the 3 behavioral health services advisory groups, and providing administrative support. Now, for the moment you've all been waiting for, we finally get to discuss our advisory groups. Behavioral Health Services has 3 advisory groups that we work with and rely on to help inform our work, particularly the Impact Fund grant program. The first of these groups is the Behavioral Health Policy Council, which is made up of 8 elected officials representing each municipality in Larimer County, 6 at-large members, and a commissioner liaison. The next group is our Technical Advisory Committee, made up of 27 individuals with professional backgrounds in the field of behavioral health. And finally, the Consumer Advisory Committee is a 15-seat group composed of individuals who have lived experience with behavioral health. As you may be able to tell from the graphic here, the TAC and CAC are both subcommittees of the BHPC, and ultimately their work and recommendations are brought to the Board of County Commissioners for review and approval. And as I mentioned previously, a large part of their work is focused on informing the Impact Fund grant program. For anyone who may want to get involved, open seats on the advisory groups are appointed by the Board of County Commissioners. And what that means is if you're interested in joining one of our 3 advisory groups, there is an application and screening process that begins in September, and those who are appointed will serve a 3-year term starting in December. Although qualifications, desired perspectives, and duties vary among the 3 groups, the principal responsibilities of all advisory group members are listed here. Also, you can find more information, including applications in September, at www.larimer.org/boards.
As Ryan mentioned, our advisory groups play a significant role in determining which areas the dollars should be directed for our Impact Fund. That is why we have 2 types of grant funding. The first is targeted, and it addresses the most critical gaps currently facing our community. Because there are so many programs doing great work out there that fall outside of these targeted areas, we also offer responsive grants, which provide opportunities to fund programs outside of these areas. The Impact Fund grant funding investment portfolio is diversified across different types of organizations in order to address the various behavioral health programming needs throughout the community. A majority are nonprofits ranging from a variety of youth programs, equine therapy, trauma and abuse counseling, veteran programs, and elder care. Independent school districts include mental health support in Poudre School District, Thompson School District, and Estes Park School District. In higher education, this includes Colorado State University and the University of Colorado. For-profits include organizations like Mindset Reps and the Willow Collective, which is a collection of therapists focused on early childhood mental health. Special district governments include Estes Valley Fire Protection District and the Health District of Northern Larimer County. In city township government, this would include housing catalysts, housing authorities, and the county government includes criminal justice alternatives and the 8th Judicial District Attorney's Office. That sums up the Impact Fund grant program, and I'll hand it back over to you, Jen. Thanks.
Great. Thanks so much, Jess. Well, that concludes our presentation about behavioral health services. I hope you enjoyed it. Perhaps you were inspired by what you heard and you're interested in getting more involved in the behavioral health of our community. Here are a few ways you can do that. Please share what you learned today with your friends and family about behavioral health and the work that's being done in our community. Everyone can help reduce the stigma that often surrounds behavioral health issues. You can also support the work of our Impact Fund grant program and take an active role in defining where the funding goes through that program by applying to be a member of one of our advisory groups, as Ryan shared with you. You can also attend a lunch and learn to learn more about the behavioral health facility and get more details about the services that will be available at that facility when it opens in 2023. There are other really wonderful resources available in our community. A couple of classes that you can take is the mental health first aid class, which is offered by Summit Stone Health Partners, and they have information about that class on their website. You can also take an overdose prevention and naloxone training, which is offered by the Health District of Northern Larimer County. To stay connected to the work that our department is doing specifically, please follow along on our website. We try to keep that updated with the latest and greatest information. You can also follow us on either Facebook or Twitter if that's your thing. And if you have any questions for me, feel free to email bhs@larimer.org and I'd be happy to answer those questions for you. Thanks again for your time today. I hope you found this presentation very informative and enjoy the rest of your Larimer 101 coursework. We're done.
Yay.